Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Chandler, Arizona. But I'm about to move to Tempe sometime, I think, in August. We're still working out the specifics. As I find out, I will let you know. But it's going to be a big move. I know this podcast is more about me and medicine, but my medical practice is an integral part of me as a doctor and a person. It's an extension of my life's work. It has been one of my greatest life's works. And I'd say that one of them because I always put my family in there. My family is the most important things that ever happened in my life. And my marriage. These things are critical to me. And my work is the other one. So it's been important. It's been a long run. And I'm just excited. I'm excited to share it with you. It's a much bigger facility than I have been in. And it's just going to be exciting. So I'll let you know as it progresses, and I'll share photos and videos. And anyway, today, fascinating, exciting material out of Shanghai, China, that shows that when a person is treated with pluripotent stem cells, they can go on to generate their own insulin all over again. People with type 2 diabetes who have a complete shutdown in their ability to make insulin, so those with type 2 diabetes that rely on insulin, there's a therapy that looks like it's going to be promising. It's coming down the line now where you just get stem cells and they just regenerate your own beta islet cells, secreting more insulin. Sounds good. Sounds amazing. How many people are going to benefit from that? A lot of people. The thing about these types of therapies is that they have a profound impact on the populations that are suffering from it. They really do. You think about it, when someone has a disorder, they're living with it and you're suffering with it. And to finally hear that there's some breakthrough that's going to help you, it's all good news, especially diabetes. Diabetes is a huge epidemic in the country, in the States. And I know around the world it's not as big as it is here, but it is spreading. So this is important stuff. And to know about that is good. So let's talk about it. How does this happen? Why does this treatment work? When doesn't the treatment work? So let me start by putting this in terms like this. When you have type 2 diabetes, initially, you have too much sugar, too much insulin. And over time, your body stops being able to generate that much insulin. So insulin levels start to drop down. And now they have to inject insulin from outside. Exogenous insulin. That's when they start having those injections they do. Where this is interesting is that no longer you have to do those injections. You just make it yourself. They just give you those stem cells and you're back on track. This sounds like a great therapy across the board. And in a lot of ways, it's like Ozempic and Mounjaro or any of those other GLP-1 meds. Because there's a certain population that you give it to them and it's going to change their lives and it's going to save their lives. And that is beautiful. Where it becomes an issue, and we should talk about this, is that when it's going to be used inappropriately. See, the thing is with diabetes, the cure for diabetes is type 2 diabetes. The cure for type 2 diabetes is already known. It's been there the whole time. For the most part, not every time, but for the most part, almost always, type 2 diabetes is a disease of consumption. What you consume and put in your body is what leads to type 2 diabetes. In almost all cases. Not everyone, but almost all. And the cure for type 2 diabetes is to stop eating those foods, is to approach the patient, help them make those life changes, and then get them on a healthier lifestyle. That's the cure. Now, some people have had diabetes for too long, and their pancreas, that's it. And these stem cell therapies, brilliant. With that said, the therapy that really works first and foremost and always is going to be diet. When patients come to the clinic, more often than not, they want to be well. Hear me out. They want to be well. We all want to be well. But more often than not, they don't want to give up what it is that got them there. People want to be able to have their cake and eat it too. So when you have a product like semaglutide comes out, and it is a game changer for many people, but for other people, it's a tool. I could do this shot and eat what I like when I like to, and I'll still lose weight. You don't eat as much, but you don't really have to do that big of a change, and people will lose weight. Or they can eat what they want, and their weight stays stable. So is that healthy? Think about this for a minute. Bear with me. If I give you a therapy that short circuits your body's response to an unhealthy lifestyle, how did I help you? Did I help you? A good physician, the job of a good physician is to find out where the pathology originates. Oftentimes is due to, in the type 2 diabetes, is due to lifestyle. Because we want to have our cake and eat it too. Literally. And we want to be able to do that, and we don't want to have the consequences of the diabetes, but we don't want to give this up. And I've sat in the room for so long with this. The topic I'm bringing up here, we all know this. This is not new. I think what I'm trying to do is I'm trying to explain it in a new way with you, especially in terms of this study. See, it's a nuanced thing. I prescribe Ozempic. Don't know this. I'm fine to prescribe Mounjaro or tirzepatide, and I'm fine with prescribing Ozempic and semaglutide when that's the right therapy. But if I'm giving someone these medications in order for them to enable them, rather, to lead an unhealthy lifestyle, I'm only putting off the bill. Sooner or later, the price needs to be paid. Sit with me on this a little bit more. If a person comes to clinic and you say, well, Brendan, how could it be bad if someone comes in, you give them semaglutide and they lose weight and their weight is stable? Sure, they're eating garbage, but their weight is stable. Where's the problem, Brendan? Because the pathology of an unhealthy diet is not just weight. There's a loss of micronutrition. There's a loss of nutrition. There's a loss of health. If these people continue on this diet and they're using this medication, they're less healthy for it. There's no fiber. There's no benefit to eating a bad diet. We need to eat healthy foods in order to operate at the best we can. Your immune system needs it. Your connective tissue needs it. Your neural tissue needs it. You need good micronutrition. So taking semaglutide in order to eat a bad junk food diet without weight gain does not avoid consequence, because you're still not going to be healthy on the other end of it, because it's not a healthy diet. It's a deficient diet. And there's enough things that will go wrong going down that road. In this study with type 2 diabetes, using stem cells to treat it, same thing. It's going to help people. It's going to help people who have that thing where their insulin, they're no longer making it. The pancreas is just broke. They can't give them the stem cells. Awesome. Awesome. But if they keep eating that diet, it doesn't matter. Sooner or later, they're going to need another round of stem cells to make more insulin. Same as semaglutide. You keep someone semaglutide, they eat a terrible diet. Sooner or later, you probably need to increase the dose of semaglutide or switch them over to tirzepatide or Mounjaro. But the idea is that, and we've tried this. I mean, think about it. We also have people on like metformin. You know, they start metformin, they're on that for a few years, it doesn't work anymore, so they go on the next thing. Why didn't the metformin work anymore? Because they didn't change their diet. They didn't go after the cure. Because the doctors didn't go after the cure. We, as a country, as a world even, some countries are not quite there yet, but most of the world gave up smoking. I don't know if you smoked. I smoked as a young man. I'll admit that. In high school, I smoked. And quitting smoking was the hardest thing I'd ever done. Like, I was up at night sweating. It was the worst. But I did it. Giving up an addictive diet is not impossible. It just needs to be promoted more. We can do that. But as a society, as a culture, we have not done that yet. We have not addressed that. So this study that comes out straight out of China, they're talking about how they're just going to be able to give you more insulin naturally occurring in your body, which is good, okay? Because if you give yourself the bolus of insulin, it's never going to be perfect. You're never going to be close to what the original plan is in your body for releasing insulin, with your food. So there's always going to be a little too much insulin. That's a common problem with this. And you're going to be able to avoid that by giving them those stem cells. Is it going to be cleaner? Yeah. But if you didn't fix the diet, they're going to still be having a problem down the road. So if I give a person these stem cells, say I was doing that therapy, I'll give you stem cells for your type 2 diabetes and let you eat the diet you want. You're going to come back in my office within a period of time for another round, because that's just how it works. And I'm going to bill you for that too. It's clever for pharmaceutical companies to generate a therapy that short circuits your body's response to an unhealthy lifestyle, because they give you that medication and you don't change your lifestyle, sooner or later the medication becomes obsolete. You got to get either a higher dose of the medicine or even more of it. I'm not wrong. I'm not wrong. And who's getting more money in the game at the end of the day? You're not. Medicine has been infiltrated by business. And business is business. And I'm a businessman. I own a business. I pay taxes. And I do all the things I'm supposed to do as a doctor to run my medical practice and to practice medicine. So I get business. I don't get the lack of ethics involved. I know the people that invent these medications have the best of intent, but a lot of times the way they're applied don't have your best interests. It's more of an economic movement of money from you to them. Giving up the diet that got you to type 2 diabetes is a monster. It is. I'm not gonna lie. I know this. I treat it. I work with it every day. But I have seen it cured. I have patients who are type 2 diabetic that are no longer type 2 diabetic. It's not easy. It's not easy, but we can do it. It's a matter of spending the time with the patient, understanding their attachment to these foods and treating it. There's some of you that don't want to take Ozempic or, tirzepatide, Mounjaro, because you don't want to cheat. You want to lose your weight and become empowered through it. And to you, I would say this: as long as you're working on your diet and your lifestyle, this medication to mitigate risks is not a bad thing. It's a naturally occurring compound your body makes. GLP-1, that's the medication. It's from glucagon-like protein 1. That's Ozempic and Mounjaro. Your body makes a variant of that. These medications were based upon something you make. If you're doing the lifestyle to change your diet, if you have the people on board with you, if you're doing the hard work to change your lifestyle, use that medication to mitigate risks and side effects and to get your weight to a healthy place quickly, not bad at all, so long as we're doing the diet. When this therapy comes online for stem cell injections, it's the same thing. If you are able to do the work, the hard work of your diet, to understand, unravel the addiction you have with your food, understand the reasons why, your food cues, whatever these things are that are driving you to eat this way. If you're doing that work, using this medication to get your pancreas generating insulin while you're doing this work here, there's no shame in that. It's only when we do these medications and avoid taking care of ourselves and we avoid the actual true cure. I hope that helped. If it doesn't, you know where to reach me. Just send me a message. This podcast means so much to me. In my practice, I think this past year has been one of the craziest years of my career when it comes to, the idea of moving the practice and growing. It's just been a very busy year in my life, and it's been very stressful in a good way. What I will say to you is that this podcast and my weekly Q&As is like a solace to me. It's a place where I go to remind myself why I'm here, why I do this. So for you being there with me and you listening and you being a part of it with me and giving me this feedback, thank you. Because it has been a bright point in every one of my days. I love your comments. I love when you comment to one another in the reels where you do those little things, you talk back to each other and support one another. I love seeing that. I love your ideas when you send me questions and ideas for future episodes. I love that. Justin and I look through them all. So thank you so much for your part in this, and I will see you at the next episode.